us now to our next speaker. Thank you, Ruchi. In advance, thank you, Dr. Michael Harbour. Dr. Harbour, and I apologize if I'm mispronouncing your last name. I didn't have time to reach out to you in advance and ask. Dr. Harbour is a physician and clinical researcher with expertise in HIV/AIDS. He serves as Chief Medical Officer of Connectwell, a public-private partnership with the UC Berkeley School of Public Health. He attended Georgetown University School of Medicine and has his master's in public health from UC Berkeley. After completing a research fellowship at the NIH and graduate medical training, he served on the faculty at both Harvard Medical School and Stanford University School of Medicine. Over to you. I'll turn the ball over to you, Dr. Harbour, and thanks in advance.
Thank you. Can you hear me?
We can.
Great. And let me make sure that you can see my slides now. Are you able to see my title slide, Engaging Patients Remotely in a Post-Pandemic World with Accurate Health Information and Digital Health Technologies?
We can see all of that.
Great. Just have to minimize the participant slide so I can see my own slides. Well, hello, everyone. Good morning. And thank you for attending, and thank you, Uli and team, for inviting me here today. I'm Michael Harbour, and as was mentioned, I'm Chief Medical Officer of Connectwell, which is a very unique public-private partnership with UC Berkeley School of Public Health. And UC Berkeley, let's see here, I'm having a problem. There we go. UC Berkeley School of Public Health obviously has a mission to improve the public health of the community. They have a very international footprint as well. And in doing so, they'd like to share knowledge, best practices, evidence-based medicines, approaches to public health, and Connectwell is their partner in helping to deliver on that promise. So Connectwell is a leading edge provider of digital health and wellness content that comes from Berkeley School of Public Health. And one of the reasons why the university does what they do, and specifically the School of Public Health, is because we have such a high prevalence of chronic medical conditions, both in the United States and worldwide, but certainly in the United States, we have quite a large share of them. 70% of chronic illnesses and their associated costs are, not surprisingly, related to unhealthy lifestyle practices. 60% of Americans are living with at least one chronic health condition, and 42% of Americans are living with two or more chronic health conditions. And in thinking about this, there are many ways that interventions and improvements can be made, not just by pharmaceutical interventions, but by upstream measurements or upstream activities that can reduce the overall incidence and prevalence of these conditions. And so this is the mission of Connectwell and the School of Public Health. Unhealthy lifestyle practices are really negatively impacting health and well-being. Not surprising, 60% of adults report sleep problems. 80% of us don't meet the physical activity guidelines. 70% of Americans are overweight or obese, and 75 to 90% of all doctor visits are stress related. This is really an alarming figure, and so much more can be improved if we can improve our sleep, our eating, our exercise, and our anxiety levels. These conditions translate into very high expenditures, and here are some of the expenditures in 2017 dollars for the most chronic medical conditions, the top being diabetes, then followed by Alzheimer's, heart disease and stroke, cancer, obesity, arthritis, and pregnancy and postpartum care, all adding up to over $1 trillion in expenditures just for these 7 conditions. On top of this, we're now entering the 3rd year of COVID-19, which has really exacerbated health conditions. COVID has disrupted routine primary care and health screenings in the UK. The number of women presenting with stage 4 breast cancer is 48% higher since the onset of the pandemic, and fewer are being diagnosed with stage 1 based on pre-pandemic data. And this is due to the delayed presentation, delayed screenings, inaccessibility of primary care and screening clinics. In the United States, the CDC reports screening for breast cancer fell by 87% and 84% for cervical cancer screenings during this time. This is quite alarming. In the United States, breast, colorectal, and prostate cancer screenings have declined sharply in April of 2020, so less than 2 years, and increased cancer deaths are predicted as a result of this. There's been 45% reduction in colonoscopies, 29% reduction in prostate biopsies, and 21% reduction in bladder cystoscopies. Excess weight gain and psychiatric conditions have increased, and excess weight gain is a very real condition. And blood pressure control has worsened since the pandemic, 1 to 2 milligrams of mercury higher. And you might not think of that small amount as a clinically significant number, but it is, and it will increase estimated numbers of myocardial infarctions and cerebral vascular accidents. So all of these things have been exacerbated due to COVID, on top of a very high prevalence rate of chronic conditions. And I'll talk about the effects of hypertension and what we may do to make screening interventions using our digital first technologies here with Connectwell later on in the presentation. So there is a new model of healthcare that has been developed since the onset of COVID, and actually well before as well, but it's become much more prevalently used with the onset of COVID, and that's the virtual care or telehealth visits. So at the right-hand side of the screen, we're all very familiar with in-person care visits, those one-on-one interactions with a healthcare provider, where a provider can actually visibly see in person and lay hands on a patient and examine them. Virtual care has really taken off in the past several years, although many companies have been doing this before. But just because somebody can add a webcam to their screen top doesn't mean that they're an expert in developing and delivering virtual care. There's so much more to it than that. Making a patient a participant in this virtual care interaction, working in partnership so that outcomes are improved, and maintaining high levels of quality care are all challenges in that virtual care visit. But one thing that hasn't been done and integrated amongst these two types of care models is the digital first interaction with the patient, whereby we can increase the amount of education and screening and preparation for these types of visits by interacting with the patient at a level and time period before these interactions take place. So this is where our digital first technology comes in, and some interactive approaches in which we can engage patients, bring them into an active participation with their healthcare providers earlier on, and we can get good information in order to prepare for these visits. And we'll talk about that here momentarily. So searching for medical information online happens to be the second most common search that individuals do, just behind online shopping. And it's important that individuals go to places where there are, vetted bits of information that are evidence-based, scientifically based. It's so easy to go to a number of these sites in our communities and in our digital world to get information, but we never know truly which one makes sense and which one is accurate. And so we've seen a lot of misinformation over the past few years that have affected all of our health. So how do we know where to go? And I'm going to give you an example of a patient of mine who actually experienced this. So as was mentioned at the outset, I am an HIV and AIDS provider. I've been doing that for 25 years. And I was recently taking care of a young pregnant woman from Africa who came to me because she was HIV positive and became pregnant. And as you know, we have made tremendous strides in the treatment of HIV pregnant women to prevent mother-to-child transmission. So she came to me, I initiated antiviral therapy, she responded well, her viral load was undetectable, and the chances of her passing on HIV to her child is well less than 1% if she maintained therapy. Well, in between visits, and she had come back for several visits doing well. I explained the importance of all this. She understood. But sometime between her last visit and when I saw her before delivery, she had read something on the internet that said pregnant women should not be taking any medication at all before they talk to their doctor because it could harm the fetus. So she stopped taking all of her antiviral medications. And then right before delivery came back for her prepartum delivery visit. And I found out that she had stopped all of her medications and I was shocked. But she took verbatim what was said on that internet site about not taking any medications and decided to do this on her own. And obviously there was a big disconnect of what we had talked about and what she was reading. And technically what she read was correct, but it greatly impaired our ability to deliver a baby that would be HIV negative. So at that point, I had to reinitiate antiviral therapy, double down on the amount of drugs that she took. She had to receive intravenous AZT during delivery, and then the baby had to receive 6 weeks of postpartum medications as well. And thankfully, the baby ended up HIV negative, but it goes to show that how we interpret internet information that we get off the internet can really be life or death changing for all of us. So when looking at online searches, some of the things that we need to make our patients aware of and ourselves as well are sponsored items versus organically derived search items. So when you go to Google and you type in some information that you want on back pain, it will show you whether this is an ad or a sponsored item versus something that's organically derived from their algorithm. Sites that look fake or require payment for more information are big clues that they are fake. Sites that promote quick cures or more miraculous instant or guaranteed outcomes are other things to be aware of. And then certainly for outdated articles, especially for topics that rapidly change like cancer therapies, we need to not only look at the article, but then to see when it was actually printed and disseminated. Because if somebody's reading something from 10 years ago, the therapies may have and likely would have changed by the time they get to their doctor's offices. So as I mentioned, COVID has accelerated the distribution of fake news. Platforms that have been used to share inaccurate or harmful content include Facebook, Twitter, Instagram, YouTube, and TikTok. There's been a lot of controversy about how these platforms have contributed to the issues that we are seeing in our communities and nationwide about the pandemic, vaccination, and whether to vaccinate, treatments, and whatnot. Typical reputable, trusted online content sources include the CDC, the NIH, FDA, and Center for Medicaid Services, state and county government agencies, academic institutions, and medical associations would be places where you can ask your patients to look for more information. And despite some of the controversial issues around the CDC and changing guidelines and updating us with new information and then changing guidelines, we know this is iterative. As we learn more, our recommendations are going to be changed. I'm glad that I'm not working for the CDC in this point in time, because you're damned if you do, you're damned if you don't. But I know the people that are running these organizations, and they're doing the best that they can with the information that they have. So let's move into what the Connectwell offering includes. So Connectwell is focused on whole person health. It's science-based, it's expertly vetted, it's up to date, and there's a multi-language capability, which is great to serve so many people in our communities. It covers a wide range of health conditions and wellness practices. Many physicians and healthcare providers are very familiar with up to date, what that can offer you in your practice. I like to think of Connectwell and the content from UC Berkeley as the up to date, but for patients. There are easy to understand articles, initiatives, recipes, and videos, and easy to search, and there's no advertising or sponsorships. And so that's why this service remains a fee for service entity. There's no one or no entity or no company that is moving information up to the front of the line in order to simultaneously deliver their product or their message or their idea. So let me just show you a short demo here for this, but our content is divided into 4 portions. One includes a medical library, which is all the different content, the different disease states, areas with which you can search for information. The second portion are wellness initiatives, which these are active things that a participant can do to improve their health. Third are healthy recipes and healthy eating guidelines. So we know that food is medicine, and eating appropriate foods and quantity of foods and types of foods can make a tremendous difference in the way our health outcomes occur. And so there's a major portion of this. And then the fourth portion are videos. These are expert videos that are coming from the University of California system, but from the UC TV. So we have the top professors, physicians within the UC system making videos and then delivering those. And again, those videos come in closed caption and can be translated with subtitles into over 100 different languages. So I'll give you an example of all of this. So let's go to a demo. You can see the overview of blood pressure.
Yes.
Okay, let me just take you back to how I got there. So we were at the Health and Wellness Library. These are the many different categories that people can look at. And as I mentioned to you, we would click on blood pressure, and then you see the different articles that come up, starting with the most simple article on overview of blood pressure. Are you able to see that?
Yes.
Okay, great. And let me just click on that. Here's a viewing of this article. Our articles are written in ways with which 5th to 9th graders can read. We aim for a 5th to 6th grade reading level. What makes it a little higher are some of the technical terms that bring it up, but we always explain those so that we know that we can serve all different people. And so these are all the different things that can affect blood pressure and the organ systems that are affected. I'm going to go back, and then let me just show you an example of a video. So this is a video of Dr. Robert Barron from UCSF School of Public Health. I will just click on this here, and can you hear him speaking?
We cannot right now, Dr. Harbour.
Okay. Again.
I'm trying to think.
Okay, one second. So if we can't hear him, I'm not going to try to go back and reshare, but I do want to show you how we can change the subtitles so that this will be available to all different patients. So he's speaking in English and the subtitles are in Spanish. All right. And so that's just an overview of how we interact with these different articles. And then there are many different conditions with which you can do that as well. Wellness initiatives, as I mentioned, are the different items that you can do to improve your health. So depending upon whether you need to improve your eating, activity levels, weight management, musculoskeletal health, you're going to be traveling, healthy travel tips and techniques, how to improve sleep, managing stress, happiness, resilience, and then maternal health, which is a world-class 3-part series on preparing for pregnancy, health during pregnancy, and postpartum care. And then healthy recipe collections from the UC Berkeley Wellness Kitchen, which are easy to prepare recipes that show pictures of what it is that we're preparing, simple ingredients to buy, how to do so, calories, fat contents, and then each recipe shows how to make it even healthier. So that's the overview of this. I'm going to now go back to my slide, and hopefully this is going to
we see it.
work. Excellent. Thank you so much for that. And so, as I mentioned here to you, we have digital health tools as well that are able to be integrated into that digital first interaction with patients. So there are many conditions that require screening and evaluation. Certainly hypertension treatment and screening is one of them that I just reviewed for you, and we're going to go into a bit of a detailed case regarding this here shortly. But these interactions can be deployed at the digital front door as a digital first strategy, and it prompts engagements and funnels people into the healthcare system. And so some of our techniques are blood pressure, or some of our tools involve blood pressure, stroke, cholesterol, screening and management, lung disorders, depression, heart disease, diabetes, obesity, and cancer. And so let's go to a sample here shortly. So some of the advantages of digital health tools include knowledge surveys that can be given to patients that inform and educate patients, again, placed at that digital front door early on in the interaction with the patient. Patients can do self-assessments to identify their risk factors. We can direct users to relevant articles. So all patients, after doing a screening, can be directed back to the sections within the content library to learn more. Then we can provide individual analytics and aggregate analytics to provide insights into population data and tool usages. And so certain communities can be screened using these interactive tools. And then we can ask patients for a call to action, and we could actually integrate final steps back to a provider, or if startup companies or companies are wanting to bring patients into their system, this could allow for them to sign up as well. So let's do a certain case study on hypertension. So there have been a number of white papers written about the content and the approaches that we have at Connectwell, and so and how we engage people in their health using these interactive tools. So we're going to go to a demo on hypertension. And are you able to see this particular slide? It says, are you at risk of developing high blood pressure?
We certainly are.
Okay, great. And so I'd like for Rushi and the team to put this link in the chat, and you can have this to do later on. But this is one of those interactive tools that can be given early on, even before a virtual visit, to help screen patients and help them prepare for a visit. So let's do this together, and I'll fill this out using some of my own data, but also perhaps skewing it a little bit so that we can get different outcomes. So it's a pop-up questionnaire. So it's asking me my gender, which can impact high blood pressure. I'm going to say that I'm a male. This automatically advances. So I'm going to click that I'm between the 56 and 65-year-old age category. Have we just asked myself just 2 months earlier, I would have been in the lower category. But do you have a family history of blood pressure? I'm going to say yes. What is my my race and ethnic background? I'm white. what is my physical activity level? What type of things do I do? So I'm going to say, oh, I'm low activity. And then what is my body mass index? Obviously very important. So it's going to ask my height. I am 5'6", so I am 66 inches. And let's just say I'm 175 pounds. How often do I drink alcohol? Alcohol has an impact on blood pressure. And let's say I drink one alcoholic beverage a day. Am I a smoker? No. And then it's asking me how much sodium do I get on a daily basis. Let's say I eat a little more than the recommended amount at 2.3 grams. How often do I eat takeout, or am I calling Uber Eats? And let's say 1 to 2 times per week. And how often do I eat foods that are high in saturated fat? Let's just say 1 to 2 times a week. Now, this is where a pop-up comes in where somebody can put their name in, their email, and agree to be contacted either by your healthcare practitioner or any organization. We'll just skip this at this point. And now this is giving me my high risk assessment. So along with the School of Public Health, Connectwell, and our digital health tool partners, we've taken all of the information that comes from the American Heart Association and taken these screening tools and then put them into an assessment here. So I've been told now that I'm at high risk for stroke, heart disease, kidney disease, eye disease, and or memory loss. And it tells me what my risk factors are, things that can be done to improve my risk factors by weight control, dietary intervention, reducing sodium, increasing physical activity, and limiting alcohol consumption, and how perhaps getting a home blood pressure monitor would improve that as well. So after I've taken that assessment, I can click on how I might want to learn more about blood pressure, which would again, take me back to the sections within the system, the Connectwell library, to improve that. So would you like to learn more about that? And yes, I'm ready to learn. And was I already aware of some of these blood pressure related problems, or do I want to learn more? I'm going to say I want to learn more. And now I have some different topics. Let's say I want to learn about drugs and medications related to blood pressure. Again, so here's an opportunity to put in your information. And then here are some drugs that can raise high blood pressure. And so this is taking you back to the Berkeley Public Health site. If I wanted to now change this into Spanish, the entire article can be changed into Spanish so that a healthcare practitioner can proactively send this to a patient or give it to them in Spanish. And the rate, the conversion rate fidelity is very high, greater than 99% accuracy, switching between English and Spanish, according to our assessment. So this is some of the information that we can give here to patients. So
Dr. Harbour, you have a couple minutes left.
Yep, thank you. So let us now move to our final slide here, which is just a wrap-up slide. And I'll give you my contact information here. Again, my name is Michael Harbour. I'm the Chief Medical Officer of Connectwell. You can go to connectwell.health and learn more about this. But we serve and do business with many different companies, medical education, or medical companies that want to provide education for their clients. This can include telehealth providers, health systems that are providing information, electronic health records. So you can imagine giving the opportunity to clients within an EHR the ability to look up this information. Doctors who want to provide this information to patients can proactively send this out before a visit or after a visit, where we're not giving out so much information. And so some of these things are the benefits of having a system like Connectwell. So I'll stop right there on time, and then I'll be available on the panel for further questions.
Thanks, Dr. Harbour, for that wealth of information. I have a public health bias, so all of that was just music to my ears. And although all the topics are fascinating, Ruchi did put the link to the blood pressure risk assessment, as you asked, into the chat. So everyone, just remember you have access to that there. Thanks again, Dr. Harbour.
Thank you.